Well, good afternoon, everybody, and thanks for joining us. My name is Jason Belton. I'm the Director of Emergency Preparedness for the California Association of Health Facilities. And you've landed at the Los Angeles County Emergency Preparedness Updates. These are the DRC updates for long-term care. And then we'll cover some other information as well as it relates to long-term care. And so this is our second go at this. And if you attempted to log into the first one, my apologies. For not getting that dialed in, and I'm not sure what was going on with my computer, but in any case, we'll give this a shot again. So it's December 6th, 2024. Hopefully you guys had a good Thanksgiving and you're enjoying the start to the holiday season. This will be our last webinar of the year, and we'll rejoin you again next year. Right. And now, sometimes we have Dr. Mary Story, who's our program coordinator for our disaster program, and or Enrique from LA County EMS. He's our disaster program manager. Neither one of them could be on the webinar today, but in any case, those are folks that are also represented in the program for long-term care in Los Angeles County. And if you have questions, certainly one of the three of us are happy to answer those for folks. Okay, so today our objectives are to just discuss the DRC updates, some CMS and state updates, especially as it relates to AB 2511, the emergency power requirement. We'll discuss the upcoming, we'll discuss or kind of review the functional or full-scale exercise that was the Mercy exercise in November. Hopefully you participated in that, and if you did, we've got some information for you about how you have to, there's a couple more components to it in order to get it, make it count for the CMS requirements. And if you want a fancy certificate that you can show to the surveyor that you participate in the exercise, you'll have to attend the evaluation conference in like a week, I think it is. In any case, we'll talk about that in a minute here, and then we'll review any upcoming trainings and our webinars. We have a ton of recorded stuff, so I wanted to kind of cover that. What we have recorded already, some of it with CAF, some of it with outside agencies. All of them are free. So if there's a topic that you're interested in, I'll point you in the right direction. All right, and just as a reminder, we tend to, in emergency management and disaster preparedness, we use a lot of acronyms. EOP, you've heard that one a lot. I just mentioned DRC, that stands for Disaster Resource Center. A lot of times we'll talk about NICS or LAC DPH, the Department of Public Health, or LAC for LA County, or MAC, MAC. I'll mention that one quite a bit, especially as it relates to how we communicate with the county during an exercise or disaster. There are a little under 400 SNFs in LA County, but give or take, there's anywhere between 380 and 400. We've lost a few during the pandemic and things of that nature. So, but a little bit less than 400 SNFs, and they're spread, pretty far across, or geographically, they're spread to all corners and all reaches of the county, except for the north part of the county along the coast. We don't see a lot of nursing homes in Malibu and Pacific Palisades and those areas, generally because real estate's too expensive to build these congregate settings. So in any case, but we're pretty spread apart across the entire geographic area. And if you look at that, it gives you a kind of a good idea. There's also another map that's a great map that I want to mention. Take note of this one. It's the HCI, that's the department at the state, HCAI. If you do a Google search for HCAI emergency operations, and it'll pull up a map, and that map will have every healthcare facility, meaning hospital and nursing home and clinic, listed out geographically on a map. And then whenever there's a natural disaster, like especially a big fire or a flood or an earthquake, if you go to that map, it will map out the perimeters of where the disaster is, and you can map it out where it is in relation to your building. Very helpful, especially in a wildfire situation. You'll be able to determine not only where the fire is at, but where it's kind of progressing to, because you'll be able to see the terrain and the wind direction, which is very helpful because those are the two things that really drive fire. So in any case, if you have any questions about that, we also have it on the disasterprep.com website. If you go to the right-hand side under the resources tab and you scroll down to the section that says statewide situational awareness, it'll pull up that map, and then you'll have to obviously kind of narrow into your geographic area because it is a map of all the facilities in California. All right, in terms of the DRCs or disaster resource centers, I mentioned this earlier, but the disaster resource centers within Los Angeles County act as our hubs for the healthcare coalition. And so all healthcare coalition activities are taking place at the disaster resource centers. There's not a central healthcare coalition meeting point like there is in other jurisdictions. In our area, what we do is, since it's so large and there's so many individual providers, it would be difficult to have one meeting for everybody. One, it's really hard to get to one central point for everybody. And two, that's a ton of healthcare providers in Los Angeles County, probably more than any other county in America. So that being said, we've got more people here, and that more people means we have to divide those kind of competencies out throughout the county so that each of us has the opportunity to engage with a disaster resource center. And the reason why that's important is because, one, the DRCs act as the healthcare coalition for our geographic area. And so all of the things that we need to get from our healthcare coalition in order to be compliant with CMS needs to come from the disaster resource center that's closest to your individual operation. And so think of the community-based HVA that CMS requires. That has to be, that generally can only be gathered from participation with that group at the Disaster Resource Center, because they will take your HVA, they'll combine it with everybody else's, meaning all other levels of care, not just skilled care, but general acute care hospitals, cliffs, clinics, hospice, dialysis, the whole lot. Everybody's putting information in. The DRC, then the DRC coordinator at that individual hospital, is taking that information and creating a master report for that geographic area. And that's the community-based HVA that CMS wants you to see, or the LA County HFID, the inspecting or licensing department. So when they come out, that's one of the things they're going to require. And it's a pretty easy yes or no. As long as you're participating in that group, you're going to get a copy of that. You'll get on their listserv and things like that. So my suggestion is, you've got to attend for at least that meeting or participate in that, engage in that process. Now, a lot of the disaster resource centers don't have capacity to seat everybody. So they generally have a virtual option, meaning you can participate virtually, and that will help you meet those needs for the HVA. The same thing goes, and once a year they do a tabletop exercise. Now, sometimes it's in a lead up to the Mercy, and most of the time it is, but sometimes it's done on other topics. And so you need 2 exercises a year. Unless you're really gung-ho to create your own exercises, my suggestion would be to engage with the folks at the Disaster Resource Center and participate in the tabletop exercise that they give, and then utilize that information to help you meet the CMS requirements. So I think it's very helpful for you as a provider to attend these things. I think there's some return on investment by spending your time there, and it helps you meet a couple of the regulatory requirements. Not to mention the fact that these are the folks that will disperse equipment and supplies during a large-scale event, because typically the county will supply the DRCs, or the disaster resource centers, and then they will disperse the equipment from there. So it's always great to have a good relationship with them. That kind of networking within your healthcare community will help fill in gaps that you may encounter during a disaster. So I think it's a high return on investment, and my suggestion is, for you to attend at a minimum at least 2 of those meetings. But most of the disaster resource centers have bi-monthly meetings. So So you'll have an opportunity to meet them on multiple occasions, or attend on multiple occasions. All right. And so here are some of the contacts, and these slides are available in the handouts. So the links are live. I did not change. I keep meaning to change this, but Essence Wilson now works. She was at Harbor UCLA. She works for the county now. So if you, if you reach out to Essence, if you're in the South Bay, and Harbor UCLA is your closest DRC center, then you want to connect with them to get the name of the new person. Or you can reach out to me individually. I apologize, I had the wrong email on there. But in any case, these are the contacts for the folks at each one of these DRCs as they're spread throughout the county. And you notice I don't have all of the DRCs on here. Whoops, I'm sorry, I went too far. One of the DRCs is set up specific for pediatrics. So generally that's not a part of who we would necessarily engage with outside of the pediatric subacutes, who of which we have within in our area. You would definitely want to contact those folks. If you don't know how to get a hold of them, email me or call me, and I will connect you with the DRC coordinator for that area. She's wonderful. But I realize that's a one-off. I think we only have one of those facilities within the county of Los Angeles. So hopefully you're aware of where the Children's Hospital is for Los Angeles County. All right. All right, updates as of December 6th. If you didn't know, I'm sure everybody's aware of this because the health order went into effect at the beginning of respiratory virus season, but all healthcare facility workers are required to wear a mask if they don't have the flu vaccine. And then there's some guidance here, and there's a link to the health officer order requiring masking of workers in healthcare and direct care settings, and then also the COVID-19 reporting requirements. And then I'll touch on the Cal OSHA COVID-19 prevention non-emergency regulations because it is specific on certain things. So they do list COVID as an airborne an ATD similar to tuberculosis or measles. Obviously, there are different diseases for sure, but are different viruses. But the way Cal OSHA sees it, Cal OSHA is not about protection for the patients / residents. They're there only for the benefit of the workers. And so they're saying that, yes, small aerosolized particles of COVID-19 will cause the COVID-19 virus. And I think we all agree that that is true. We've seen it happen multiple times in our settings, and it really doesn't really matter what nursing home you work in, or assisted living, or hospital, or any congregate setting. You understand this. But Cal OSHA has said that in order for us to protect our staff, whenever they're doing any aerosol generating procedures on somebody that's COVID-19 positive, then they would need to be wearing some type of PAPR or elastomeric respirator. The N95 would be discouraged for that type of use. They really want to see folks use their PAPRs. The good thing about a PAPR is, the PAPRs are reusable. And so generally you buy one and that will work for a significant period of time. It's not a disposable unit. It does need to be cleaned and it needs to be cared for, but you can use that. So here's the actual requirement from Cal OSHA, ATD standard. They require the use of N95 respirators while working with somebody just with COVID-19. And I'm not even talking about the aerosol generating procedures, but anybody in that kind of 6-foot bubble of the resident needs to have an N95 respirator at a minimum. Finally, let's see here. And there's interim guidance for managing these things based on the CDC guidance. Employers and facilities can have policies that are more prescriptive, but generally not less prescriptive. And I mentioned that the elastomeric and/or the PAPRs. A PAPR stands for Powered Air Purifying Respirator, and those are the hoods that you see go on that have kind of like a little tube that feeds possibly pressurized air into the hood, so they're only breathing stuff that has been filtered through that little unit. And they're easy. They don't require fit testing, which is really good. So that saves you some money on the fit testing component. Um, it's also good for somebody that you may have just hired or onboarded that has not been fit tested yet. And if that's the case, they can use a PAPR without being fit tested and still do those activities. And that includes just regular normal care. I would say that I don't know if you're familiar with what the elastomeric respirators look like, but those ones, I'm not a geriatrician, but if I was a little bit older than I am now, and I'm not a young person, but if I was a little bit older and had some cognitive issues, it may be disconcerting to see somebody wearing an elastomeric respirator, because the way they look has these big filters on the side. It almost looks like a paint mask. That's a real similar, like people you see painting cars, or it looks like Ant-Man's mask, and it's a little unique looking, certainly, and so I think that might throw people off. I at least with the PAPR has the big window in the front, so you can see somebody's face. You can kind of make out their lips. It may be better because it seems like it's a clearer view of somebody's face versus the elastomeric respirator is a very kind of industrial look to it. And so that may bother some folks. I'll leave it up to you. You guys are certainly the experts when it comes to how it could impact your residents. But my thought is the PAPR might be better for it. And to be honest, I think both of them are fairly close in price. I think the PAPR is probably a little more expensive, but you may get more use out of it, and more people would be able to utilize the PAPR. All right. And I get it. And unfortunately, we're not able to transfer out COVID-19 residents like we would, like tuberculosis or something like that. We have to keep generally have to keep those folks in house unless you have some agreement with another provider with an airborne infection isolation room, where they could be in their negative pressure 24/7. Sure, I think, but the reality is generally when these things happen, the hospitals that would normally take a tuberculosis person are not set up and equipped to treat somebody that has no acute kind of illness, that just has a communicable disease. And so, fair or not, they're going to leave them in our settings, throughout their infectious period. And obviously we've seen that through the pandemic. So I think hopefully you're prepared for that, and you're ready and you understand what to do. But with everything, if you have questions, both you can contact CAF or the ACDC unit at Los Angeles County Department of Public Health, or LACDPH. Those folks can definitely help you out and guide you. They're generally not a regulatory body. They're more there for to assist us in understanding how to protect our residents. So, in any case, well, let's switch gears and talk about the Mercy. I can't remember if I thought I had a slide in here. In any case, the Mercy exercise was held on, I think it was 16th, 17th. In any case, it was the third Thursday of last month, so the week before Thanksgiving, and we did the exercise. Hopefully you did the exercise at your facility. And I always get this, it's on the day of the exercise, people will call me, okay, what am I supposed to do? And I go, well, you're simulating a disaster scenario at your actual building. And that means that you're doing it just like it would happen in real life. And so that means if you're simulating evacuation, you're going around and you're moving beds out of the room, you're wheeling wheelchairs out of the room, you're staging them in the front of the building, you're contacting your transportation provider, and you're simulating that contact with your transportation provider. But it requires actual movement. You're actually doing the work. It's a lot more work than people think it is. And so I get the impression that a lot of people think it's just something they participate in. No, it's something that you're doing at the same time other people are doing it. And so Every facility, the public health department, the EMS agency, the medical alert center, all of the hospitals, everybody is pretending like this is the disaster and it's happening at their facility. Ideally, that's how we want to do the exercise. And that way we can test not only our own performance, meaning the facility itself, but also the performance of the community and how we can meet the needs of each of the individual facilities. But we can only do that if you're practicing and you're putting your plan to the test. So when there is a mercy or a functional exercise or a statewide medical health exercise or a community-based full-scale exercise, it doesn't mean you're doing their work. It means you're doing your work at the same time they're doing their work. Hopefully that makes sense. Now for us, we'll talk about this. I think I have a slide on this. There is an after action kind of evaluation conference slash webinar slash presentation that we want you to engage in so that you can tell us what your gaps were theoretically, and we can build a master kind of after action report for everybody, every portion of our segment of healthcare. And so the hospitals will all do that, and they'll all submit that to the county. Ideally, every skilled nursing facility, every dialysis, every clinic, every home health agency, they are all completing these after action reports and submitting them to the county so that one, they can get their certificate saying they participated in the exercise, but two, to help the community understand where the gaps consistently lie across different settings. Like if there's a gap in communication between us and long-term care or between the county and long-term care, and that's consistent across multiple providers, then we have to look at bolstering our communications platforms, whether it be changing how we communicate with you or changing how we educate providers on how to engage with the county and utilize the communication platforms. You know, those are all things that we want to test. So the county will really kind of gather all that data. So hopefully you find that helpful to help understand what it is. We recorded a training video earlier this year on what it looks like at in an actual nursing home or skilled nursing facility, what a functional exercise looks like. And I can show you pictures now where I'm not finished editing the video yet, but by the end of this kind of budget period, which ends at the end of June of 2025, I should have the entire video completed. But ideally, it will help walk you through what it looks like to have to participate in a functional exercise at your building, because it's a lot of work. Even though somebody else is putting all the materials together for you, the work of actually doing it and evaluating the performance of your staff takes a long time. And there is some lead up to it. There is definitely impact to operations on the day you do the exercise. So you have to consider, how do we do the exercise without impacting patient care? What staff can I pull away to actually simulate all these activities? Can I get volunteers? There is a lot that goes into it, and a lot more than most people think, and certainly a lot more than CMS has factored in in their assessment of how much or how little time being compliant with the CMS or the EP requirements are. I personally think they're a full-time job at a hospital. I'm not certain why the same rules apply to a nursing home, with the expectation that its other duties is assigned for the administrator or maintenance director or DON or DSD or whoever. In any case, I did mention we do some other trainings and webinars. I'm very proud of this one because it was in conjunction with a bunch of different folks that offer best practice information from a multitude of different jurisdictions. So it wasn't just CAF, it wasn't just Health Services Advisory Group, it was Department of Public Health, it was folks from FEMA, it was folks from the federal government, ASPR. We just had a tremendous kind of gathering of different professionals with some of the most are some of the best minds in emergency preparedness as it relates for long-term care in the country, have recorded these sessions. So it's not just me. I don't want to blow my own horn, but there were tons of people much more talented than I am that joined me on a number of those presentations. So um, I hopefully you've had a chance to review these. These are there's no CEs attached to them. I don't believe so. They're more for your own edification, but hopefully, and they're these some of these are not necessarily maybe the top deficiencies are time specific, but a lot of the things that we talked about, HVA. HVAs, NICs, EIDs, or EID stands for Emerging Infectious Disease, transportation, business continuity, surge, how to do exercise, EOP updates. All of those are not time sensitive. They're really helpful to help you understand each of these different components as it relates to preparedness and long-term care. So you can access those at that link there. Um, and feel free to peruse those. I mean, I wish they were up on a like a YouTube or I can't remember the name of the other one, but there's a couple of those free platforms. It'd be great if they had them on there, but unfortunately, you have to go onto the HSAG website to be able to view those. If you didn't know that, well, it's not so new anymore. It's been out for about a year now, maybe not quite that long, but we do have a coalition website. So LA County Healthcare Coalition, or LACountyHCC.org. You can go there and find a number of the materials. Plus, whenever there's a training, or we do like in May of next year, we'll do a business continuity workshop. And I highly recommend for folks, if you're not familiar with that means, this is the plan that you want to have to help your business stay in place. And ideally, if your business stays in place, you can continue to provide care. And that's CMS's goal, right, is for continuity of care. So in order to do that, our business has to be functional. And it's not just the care side of it, but it's other things like timekeeping and medical records and personnel records and just a number of different things. And I like to give this example because we had that Kronos, which is a timekeeping software. Individual healthcare entities weren't affected by the cyber attack, but the company at large was affected, which affected all of their account holders, which was, I don't know, 700 or 800 nursing homes across the country used the Kronos to do their timekeeping. So they had to have downtime procedures. And of course, that clock in, clock out procedure at time change went from being quick to now being a lengthy process. And that lengthy process could then impact our ability to provide care or have that transition of care from one shift to the other. And so it's examples. That's a small example, and it really didn't impact patient care, provided the folks had some kind of downtime procedures that would, resolve the issues without impacting care. So it's those kind of planning items that we need to think about beforehand. And generally, at that business continuity workshop, you're not only going to hear from maybe hear from me, but mostly hear from folks that have done business continuity planning in healthcare organizations before. And I always find that incredibly helpful to hear from our peers to say, this is how I do it. This is how the roadblocks I ran into, and this is the time commitment it took to get it done. And that's really what some of the things we need to see. So hopefully you'll monitor that on the Healthcare Coalition website and plan to attend that in May of next year. They're generally at the Santa Fe Springs Town Center, which is next to the Los Angeles County EMS Agency's headquarters. So if you're thinking about planning for your time commitments for next year, try to keep an eye on that for May of next year. And then that stuff will be listed on the main side. And then on the skilled nursing side, we have a number of resources and materials that we hope to continue to add to that will be specific to skilled nursing. And a lot of things like if we record a NICS training or an evacuation training or something like that, where you're not able to attend, the hope is that we can post a link to at least a free version of that on YouTube so that you could go and watch it at your leisure. Generally, if you need continuing education with stuff, you're going to have to do that live because there's challenge questions now and all these other things you have to do. in order to get CEs. But if you don't need CEs, just want to review the material, we're going to post that stuff there. And it'll also be posted on our YouTube page, which is listed here below. So in terms of some of the stuff that we've done, and some of the stuff we've contributed to. So there's a large guide that was released by California's Department of Public Health, and it's called Wildfire Smoke Considerations for California's Public Health Officials. And I include that because it's helpful in understanding where the impact could be, some of the best practices around kind of minimizing wildfire smoke. But it's a big read. It's a lengthy read. It may not be above folks' heads. If you're more interested in what are practical ways we can manage wildfire smoke and or any of these other kind of industrial hygiene topics like mold or Legionella or water incursion or airborne infection isolation rooms, which is the AIIR. If you're interested in any of these topics, we have a number of free videos on our YouTube page, recorded by one of the best industrial hygienists on the planet, frankly. And he's given us, 15 to 25 minutes on each one of these different topics. And wildfire smoke and wildfire smoke mitigation is one of those topics. So if your IP or your infection preventionist is interested, or your maintenance director is interested, those videos are available for free. And we also we had Derek speak at our maintenance director conference in August of last year, or August of this year, and that we're going to have him speak again in April of next year. So we're going to do a maintenance director workshop in April of next year. I believe that's going to be at the Marriott in Burbank. So right next to the airport, if you're familiar with the Burbank Marriott. And they have a large convention center that's attached to that hotel. So easy for folks to fly in and out of if they're coming from outside of the area, but certainly here within the county, it's all within driving distance. And you can go to the CAF.org website and sign up. Their registration is available now. All right, so in terms of communication platforms, I mentioned that, especially as we talked about the Mercy exercise, what we typically see is the Mercy ReadyNet will send out service level polls during the exercise, and a service level poll just says, hey, are you okay? Or, let us know the status of your facility. And if you need assistance, and it's a color coded process. So green, yellow, red, or black. And so you kind of choose which one you are. What we're seeing is that people are not actually utilizing the platform during the exercise. So over 300 facilities are signed up on ReadyNet. And ReadyNet is the primary form of communication with LA County during a disaster. So in your CMS emergency preparedness requirements, this is a heavy requirement, and it should be. This is communication is one of the most difficult things we'll need to do in a disaster, and it's one of the most utilized things during the disaster. So we're going to need that communication platform. If folks aren't logging into ReadyNet to answer the bed polls, or answer the service polls, we're going to have a terrible response during a disaster. And so you guys have to log into ReadyNet at a minimum on the day when we do the exercise, so you can answer the poll. And I realize ReadyNet is kind of like an always-on system for the hospitals. We just have to understand this is how the county wants us to engage with them. We have to understand that that is our primary way to engage with them. So if you're unfamiliar with how to log into ReadyNet, you can't remember how to utilize the system, you don't know what a service level poll is, well, good news. There's a training given on December 9th from 10 to 11. That's free. You can go to ReadyNet and sign up and register for that. They also do one-off trainings, and they also have recorded trainings and a user guide as well. So really no excuse to not understand this. I don't think it's particularly difficult. I think probably the hardest thing is remembering your username and password. If I'm being honest, that part is the one that always trips me up. So my hope is that you guys will engage with them. Lewis West is the gentlemen that I usually deal with. And you can always reach out to them or to Lewis himself, and they'll be happy to get you squared away with either a one-off training or tie you into the most or the next upcoming training for the non-hospital sectors. All right. All right. So if you didn't know, we recorded a video on the 96-hour fuel storage and safe temperature requirements. That's the emergency prepared or emergency power requirements that were passed under AB 2511. Now we've got a postponement of the drop dead date of when you have to have it installed. That will be January 1 of 2026, so about a little over a year away from now. That requirement will go into place. At the moment, we don't have a very good indication of how many folks have completed the process. I think it's probably less than 50 in the state is my guess, maybe even less than 25. And so that leaves about 1,100 facilities. Well, the distinct part SNFs or the SNFs attached to a hospital, this does not apply to them for some reason. I'm not sure why they were written out of that, but in any case, this only applies to the standalone nursing homes. So that's probably about 1,100 instead of 1,200. And then you take about maybe 50 that are compliant, maybe 100. So we've still got 1,000 or more facilities that need to get either started on the process or need to complete the process. We've talked to a number of facilities that say feasibly, I don't have the ability to add this large of a generator that could then back up those HVAC units. And in those instances, we're trying to work with the department, both HCI, which is the building department, and CDPH, which is the licensing department, about how we can come up with either a waiver or a program flex requirement, simply because it's not feasible to add these, and if they take a hard line with that, it would just mean facility closure in that case, or some other kind of creative way to construct these things. I don't know if you could do a roof mounted kind of generator or what. It would be an engineering challenge, let's put it that way. And in some instances, that's not feasible. In some instances, it may be feasible, but it's not financially affordable. So in any case, I don't think the goal of the legislation was to get people to close and reduce access to healthcare. I think the goal was for us to consider having safe temperatures during a disaster. And so if you have questions about this, we've recorded a video. There's some opportunities to do some renewable energy options. But I caution you away from folks that walk into the building or contact you and say, I have a temporary solution. If you sign a contract with me to bring these solutions to your building in the time of a disaster, that will be compliant with the rule. And it's my understanding that these need to be permanently engineered solutions, and a temporary solution is not written into one of the allowances in the legislation. So, trust me, I tried, and that's one of the first things that we asked them to do. And there may be some opportunity to do that in the future once they see how stinking expensive this is going to be and how the state is on the hook for reimbursing at least a component of it. And my hope is that the budget is so bad that the governor and or the legislature decides to postpone this for a significant period of time, or allows us to do temporary or alternate means of compliance. So in any case, that webinar is recorded. It's on demand on our website. We also recorded the Nursing Home Incident Command System webinar, and that's available on our website if you want CEs. You can watch that on YouTube, on that same CAF TV YouTube page. There's a number of recordings on NICS. We re-record a new session, generally for a different jurisdiction, sometime maybe quarterly throughout the year. And I don't think the material changes a bunch. We like to just kind of sprinkle in newer events, and so there may be some information about new events that we talk about versus old ones, but primarily the material is very similar and it will stay through, forever. There's not a lot that changes with ICS, and that's why It's utilized by so many different agencies managing large-scale events. Fire, law enforcement, schools, hospitals, everybody uses that ICS structure. So I don't think that part is going to change at all. We may have some small minor changes within the kind of suggested like incident response guides or job action sheets, but traditionally the NICS program is going to be the same. We'll just sprinkle in some new information. So, all right, and the Really Ready conference is in April in Hilton and Irvine in 2025. We really look forward to seeing you there. Everybody that's on the Los Angeles County Healthcare Advisory Group with us. So if you're a long-term care provider and you're interested in joining our long-term care advisory group for the county, meaning you will contribute your expertise on helping the county plan for disasters as it relates to long-term care specifically. So this is an opportunity to provide feedback to those folks that are, would oversee disaster response for our segment of healthcare. And so I'd like to, offer the opportunity to have folks come and participate in that. If you're on that work group, you would get free admittance to the Really Ready conference. And that's a part of one of the benefits participating in the work group is to be able to have you attend this 2-day session that would really help you out. So if you have questions, don't hesitate to reach out to us. The registration link is there on the bottom. It should be a wonderful time. And I mentioned that we were going to have a long-term care skilled nursing facility maintenance workshop. That's designed for administrators, maintenance directors, safety professionals, and especially corporate staff that oversee physical plant or maintenance from a multi-facility level. And we'll talk about optimal facility management practices, and we'll talk about things like security, vulnerability assessments, which is a requirement under the Workplace Violence Prevention Plan requirements. So we'll talk about that. We'll talk about, what a safety officer is in the incident command system. And that's generally something that's performed by a maintenance director, or the tasks and the strategies of a safety officer during a disaster really lines up well with having maintenance perform those functions. And but there's also other things within incident command, like the infrastructure branch director, that will oversee the built environment. And so if I like to tell people this, especially non-maintenance staff, the building is a shelter first. And so we have to understand that there is a very critical component of responding to disasters, and that's maintaining a safe environment of care. And your maintenance staff needs to be equipped and prepared to do that. And so that's going to be a part of the workshop. So hopefully they'll really take a lot home from that. And our plan is to do this annually, because I realize it's difficult to get maintenance staff out of the building. And so what I may have to do, though, is I may have to alter 1 year in Northern California, 1 year in Southern California. This is 2 years in a row in Los Angeles. So I may have to move it up somewhere north so that folks don't always have to fly down here to go to the workshop. All right, I mentioned the full-scale exercise training. And if you're interested in observing or participating in a joint county SNF evacuation exercise of a facility, now we've already done one, and we're looking to find other folks, that would be open to having us come, create the exercise. We'll do all the work of creating the exercise, but really opening up your building and assigning your staff to participating with us, and having you as the administrator walk through the exercise with us, but not actually participate in it. I think what it will be helpful is you, as the administrator, learn how to be the evaluator or observer or conductor of the exercise. But it's great if you want to participate and have somebody else evaluate, but make sure that they're empowered to do it. If you're a corporate entity, you could have somebody from corporate come and evaluate your performance. That may not be you may go on, I don't know if I'm ready for that one, but in any case, a part of doing any exercise is an evaluation process, and evaluators ideally should not participate in the exercise. They're not going to participate. They just want to review work in a kind of no fault environment. And a lot of times we find that to be best, the administrator best equipped to do that. Plus, the administrator will, one, learn from watching other people do it, but two, will learn what competencies their staff have and how comfortable or how confident they would be in kind of putting our plan into place. Would they know how to get the right information? Would they make missteps based on what they think is the right information rather than referring to information you have in your plan? All those kind of things you'll be able to review if you do it outside of that. So reach out to me if you're interested in participating in that. We can't do it for everybody. It has to be kind of a one-off thing because it takes a lot of time to prepare these exercises and to line up all the people that would come participate. But ideally, you would say, yes, I want to do it. I want you to help write it. And I'm okay with other skilled nursing facilities coming to participate with us, meaning they're come review or at least have a view of what our actions look like, because this ideally will help them as well. All right. I mentioned you could reach out to me with questions or comments or anything like that. And luckily, the technology has worked all the way through this. I am going to attempt to stop sharing my screen and go back to see if we have any questions or chat. But before I do that, I want to say thank you very much. Everything that you see today is available in the handouts, and you're more than welcome to download those. All those links are live on the handouts. And then if you have questions on our cafdisasterprep.com website, we have LA County specific resources there. So it's /LA County, along with a ton of other material, for that's specific to skilled nursing. I realized that it's like a Wix website. It's not fancy in any way, shape, or form, but it's, if I'm also the emergency manager and the website manager, you get what you get. I'm sorry. It's really difficult. That's not my strong suit. So I was lucky. Wix is fairly easy for us to make a website and add links to it. But, in terms of the aesthetic of the website, it's probably not my strong suit. Anyways, hopefully everybody had a wonderful time today. All right, let's see if I can figure this out. Okay, well, I think we're back to the main screen. I'm not sure yet, but in any case, I don't see any questions or chat, and hopefully I did this right. I apologize if I'm looking at this incorrectly. It looks like there's no questions, but if you do, don't hesitate to reach out to us. Gosh, I don't know how to put my title or my contact information back on the screen. But in any case, it's jbelden@caf.org. Feel free to reach out to us, and we'll be happy to answer any questions you may have had from this presentation and or just on an ongoing basis. So good luck to you. Hopefully you have a great weekend, a great holiday season, a happy new year. We will talk to you again in 2025. Thanks very much and have a great day.